good afternoon, everybody. I'm Tiffany, and I'm going to give you a short presentation on the healthcare crisis that's going on today in America. We've got a lot of things to worry about. We've got zombies, we've got terrorists, we've got aliens, but the biggest concern that we're all focused on is what's happening to the American people. And this is your average American male today. Now, today's session is really interactive, and I do have some prizes for those of you that choose to participate. So let's take our first little quiz. What is the average weight? And this is for a Bose wireless headset in blue. What is the average weight of an American male today? I saw your hand first.
220.
220, wrong. You?
240.
240, wrong. You?
260.
260, no. You?
208.
Nope, gotta go the other way. You?
175.
175, close.
185.
185, I'm gonna cut it off there. 195 pounds. Here you go. In blue, congratulations.
Okay. Awesome.
All right, now look at that belly. What do you think the average waist size for the American male is today? And I do have a demonstration here. These are the average size shorts. In the way back. 42, no? 40. You are the winner of the kitty cat shorts. I'm going to hold them up so you can all see. Here you go.
You want to trade?
So today's male is 5'9", 196 pounds, and weighs and has a waist of 40 inches. 38% are obese, 70% are overweight. Those are frightening statistics today to think about. And on top of being overweight, that's just one side effect. America's not well. We've got heart disease, we've got cancer, we've got diabetes, we've got depression, we're stressed out, and we really don't eat all that well. This has gotten the attention of employers. And I didn't really give my intro, but I'm actually an insurance consultant. I work with large market American companies on designing their healthcare programs and trying to get their employees healthy, keep them out of accidents at the workplace, and keep them engaged in what they're doing. 72% of where you get paid comes from private plans, which is driven by the employer market. Employers are really concerned. They're looking at 5 things. How do they attract and retain talent? How do they manage productivity? How do they manage their risks and staying in compliance? I mean, you just had the Medicare lady, you know how hard that is. ACA falls into this bucket. And they're really concerned about getting affordable help. Last year, there were 100,000 workers' comp claims that were filed. If it went to court, the average verdict was $250,000. If they settled, it was $75,000. It costs on average $450 an hour to have an attorney engaged. What do you think a tired worker, what kind of risk do you think a tired worker poses? It's a dangerous risk. They're getting hurt in the workplace, and in addition to not being productive, they're costing a lot of money. And that's just on the risk management side. On the other side of the house, employers are paying $23,000 a year to provide insurance for a family of 4. And you just saw how overweight most workers are. They're paying close to $1,500 on top of that to cover those health conditions associated with obesity. Half of all adults have at least one chronic condition. And our work is different today. We're sitting down, we're typing, we're sedentary. It doubles our risk for developing diabetes. And we still have smokers who, on average, they die 10 years earlier than others. So as corporate America is really looking at the workplace safety, the cost for this, it's gotten their attention. And they've also noticed people who are tired, they perform poorly. They actually perform poorer than people who've been drinking. So you've got 45% of America that reports they have trouble sleeping. They also have all of these conditions, which, as you guys know in the medical practice, it just compounds the impact of that. If it's left untreated, people are unhappy, but they have poor performance. And this is what's really getting corporate America engaged, as well as when you look at their claims data and the cost for the insurance that goes up 20% each year, these diseases are becoming more and more prevalent and more costful to the employer side of things. It's about $480 billion in spend. And there's at least 15 million people. And I heard some chat out there in the networking that you guys know that there's this many people, but how are you getting them in your offices? How are you getting people to actually address this issue for themselves? Well, here's our issue. 90% of people are undiagnosed. So what is going to get these people to try to address the problem head on? This is where corporate wellness programs come in. Some of the larger firms that I'm working with today are doing very intensive wellness programs where employees are encouraged. Some have a carrot, some have a stick, and they're encouraged to participate in these wellness programs, usually to get points and prizes, but a lot of times they're getting discounts off what they're paying for their insurance coverage. And employers are doing sleep programs today in certain industries to help drive down costs. All right, for an Apple Watch. What is the most common symptom of sleep apnea? Yep, snoring. And it usually comes in the form of spousal complaints. So here you go. So companies have kind of gotten on board around, all right, we know we have a problem. Let's put together some corporate wellness programs related to sleep. And these programs are designed where they get people in to do the sleep studies, whether that's at a clinic or at home. And then they're getting all their goods. You saw the charts earlier, but all these great things are being recorded. This is an example of what we did for a trucking company. So we work with a lot of firms that maybe have 3-shift employees, like a hospital or a manufacturer, or you have industries where it's compliance related to actually get tested. So this was a large trucking firm. We put in that people could go and do the wireless monitoring at home. They got connected with a sleep physician specifically designed to be attached to this company. They did their test, they had their equipment, and they also got a sleep coach. So when we talk about the monitoring and the follow-up, they're doing this through the corporate program because not only if they do all these steps will they get points and credits, but they're actually starting to feel better. And this driver, rather than doing this over a couple-month period, was back out on the road in 1 to 3 days. That has a huge impact to this employer in particular, because as you guys know, it's out there. Apnea is out there and it's impacting performance. Here's another one that was for waste management. They went through a similar program and they reduced their disability cost 80%. They reduced the days absent 72%, and they saved about $6,000 per driver just by having this corporate program. So as we think about how to get patients, don't ignore the corporate sector because it's a great way to get the push and the engagement from the employee side. Here's another case from J.B. Hunt. They had reduced accidents and reduced hard braking events, and they overall reduced their medical costs. So we found a way to get tangible return on investment for this company to pay for this sleep program, which is just packaging all the different services that you've heard about here today, getting people to self-identify, do the study, get their results, participate, and come out a happier, healthier, more engaged employee. Here's a couple of different vendors we work with who have specific programs designed for corporate America. Fusion Health takes a more electronic approach where it's a mobile app, so the employees can actually download it, take it at home. And then based on the diagnostic and it's a virtual physician kind of visit, so they do the telemedicine approach, you get your different device. And as you guys can see, the average cost is between $1,800 and $2,000 from soup to nuts, and that's before insurance pays. Most folks in America either have an HMO, a PPO, or a high deductible health plan that's covering a portion of this after they meet their deductible. So you're going to get patients who are going to shop around and ask you questions on cost as well as, will this work for me? So I did want to end today's quick little session by thanking you guys, because what you're doing is actually helping corporate America go on these programs and help take unproductive workers back to productive. This is a little bit about Epic and my contact information in case you guys have more questions. There you go.